Hey, Golden Vitality family. Ever wondered if masturbation affects your prostate health as you age? You're not alone, and today we're clearing up myths, breaking down medical facts, and revealing what experts really say about it in your senior health. Stay tuned. You might be surprised at the truth. Hello and a warm, friendly welcome to you from all of us here at Golden Vitality. We're so glad you could join us today. Here, we believe in aging vibrantly, embracing every chapter with health, dignity, and joy. We know that as men journey through their 60s, 70s, 80s, and beyond, certain health topics become particularly important. High on that list for many is prostate health. It's something many men think about, worry about, and have questions about. At the same time, discussions around sexuality, including personal topics like masturbation, can sometimes feel sensitive or private. Our goal today is to bridge these topics respectfully and provide clear, helpful information based on current medical understanding. We want to explore what older men should know about the connection, or lack thereof, between masturbation and the health of their prostate gland. We'll aim to separate fact from fiction, offering insights in a way that feels like a helpful chat with a trusted friend or advisor. As always, while we strive to provide accurate general knowledge, please remember that your health is unique. This conversation is no substitute for personalized advice from your own doctor or urologist, who know your specific situation best. They are always your most valuable resource. So please do talk with them about any personal health concerns. Navigating our later years often brings a well-deserved sense of perspective. We might find deep satisfaction in mentoring younger generations, pursuing hobbies we finally have time for, like woodworking, fishing, or perfecting that golf swing. Perhaps it's the fun of watching the sunset from the porch, volunteering for a cause we believe in, or simply enjoying the fellowship at the local community center or coffee shop. Maintaining our health allows us to continue engaging in these activities that bring richness and meaning to life. For men, part of maintaining health often involves paying attention to the prostate gland. It's a small gland, but it can sometimes cause noticeable issues as we age, ranging from urinary changes to more serious conditions. Because it's a common area of concern, many questions arise about what influences its health. We focus on diet, exercise, regular checkups, all crucial. But sometimes, questions also surface about more personal aspects of life, like sexual activity, including self-pleasure or masturbation. For generations, myths and misinformation have sometimes clouded discussions about sex and health. You might have encountered old beliefs suggesting that certain sexual activities could harm the prostate, or, conversely, wondering if they might offer some benefit. Let's approach this topic with clarity and respect, focusing on what current medical science suggests specifically about masturbation and prostate health for older men. First, let's quickly define our terms simply. Masturbation is the act of stimulating one's own genitals for sexual pleasure, often leading to orgasm and ejaculation, the release of semen. It's a private act, a normal part of human sexuality for many individuals across the lifespan, regardless of relationship status. Now, let's talk about the prostate. What is it? And why is it relevant? Understanding your prostate gland. Think of the prostate as a small gland, roughly the size and shape of a walnut, located just below the bladder and in front of the rectum. It surrounds the urethra, the tube that carries urine from the bladder out of the body. Its primary job is to produce seminal fluid, the milky liquid that nourishes and transports sperm during ejaculation. As men age, the prostate often undergoes changes. These changes are common and don't always signify a serious problem. But they are why regular checkups are important. The main conditions affecting the prostate, especially in older men, include Benign Prostatic Hyperplasia, BPH. This is a non-cancerous enlargement of the prostate gland. because the prostate surrounds the urethra. When it enlarges, it can squeeze the urethra, leading to bothersome urinary symptoms like frequent urination, especially at night nocturia, urgency, a sudden, strong need to urinate, difficulty starting, urination hesitancy, a weak or interrupted urine stream, dribbling at the end of urination, feeling like the bladder isn't completely empty. BPH is very common, affecting about half of men by age 60 and up to 90% by age 85. But it is not prostate cancer and doesn't increase the risk of developing it. Prostatitis. This refers to inflammation or swelling of the prostate gland. It can cause various symptoms, including painful urination, difficulty urinating, pain in the groin or pelvic area, and sometimes flu-like symptoms. Prostatitis can affect men of all ages but can sometimes be chronic or recurring in older men. There are different types, some caused by a bacterial infection and others where the cause isn't clear. Chronic pelvic pain syndrome. Prostate cancer. This occurs when cells in the prostate gland begin to grow uncontrollably. It's one of the most common cancers in American men, particularly older men. Many prostate cancers grow very slowly and it may never cause significant harm, while others can be more aggressive. Early detection through screening, like the PSA blood test and digital rectal exam, or DRE, is crucial because treatments are often very effective when the cancer is caught early. Given these common conditions, it's understandable why men want to know about factors that might influence their prostate health, positively or negatively. So, where does masturbation fit into this picture? Masturbation and prostate health. Debunking myths and exploring science. Let's start by clearing away old, unfounded fears. There is absolutely no scientific evidence to suggest that masturbation causes BPH, prostatitis, or prostate cancer. Myths from the past suggesting that sexual activity somehow harms the prostate are simply not supported by medical science. In fact, the conversation in recent years has shifted towards exploring whether regular ejaculation, whether through masturbation or partnered sex, might actually have some potential benefits for prostate health, particularly concerning prostate cancer risk. The prostate flushing hypothesis and research finding. One theory that researchers have investigated is sometimes informally called the prostate stagnation or prostate flushing hypothesis. The idea is that the prostate gland produces fluid continuously. If this fluid isn't regularly flushed out through ejaculation, potentially harmful substances like carcinogens that might enter the prostate from the bloodstream or urine could build up within the prostatic ducts. Or tiny calcifications, prostatic calculi, might form, potentially leading to inflammation or, theoretically, increasing the risk of cancer development over time. Therefore, regular ejaculation might help keep the ducts clear. Think of it like regularly flushing the pipes in your home to prevent buildup. So, what does the research say about this idea? Several large observational studies have looked at the association between ejaculation frequency and the risk of being diagnosed with prostate cancer. One of the most widely cited is the Health Professionals Follow-Up Study from Harvard, which followed tens of thousands of men for many years. Findings from this study, and some others, have suggested that men who reported higher frequencies of ejaculation, e.g., 21 or more times per month, averaged over certain periods of their adult lives, appeared to have a lower risk of being diagnosed with prostate cancer compared to men with much lower frequencies, e.g., 4 to 7 times per month. Important caveats: correlation versus causation. Now, this is where we need to be very careful and precise. These studies show an association or correlation, but they do not definitively prove causation. What does that mean? Correlation: two things seem to happen together. GT. Higher ejaculation frequency and lower prostate cancer diagnosis rate. Causation: one thing directly causes the other, e.g., frequent ejaculation causes the risk to be lower. Observational studies like these can't easily prove causation because other factors might be involved. For example, perhaps men who have higher ejaculation frequency also tend to have other healthier lifestyle habits, better diet, more exercise, less smoking that are the real reasons for their lower cancer risk. Or perhaps there are underlying biological factors related to both sexual function and cancer risk. So, while the research is intriguing and suggests a potential protective link, it's not conclusive proof that masturbating frequently will prevent prostate cancer. More research is needed to fully understand the biological mechanisms, if any. And to confirm these findings, what does this mean practically? Don't rely on masturbation for cancer prevention. It would be unwise and potentially harmful to think that frequent masturbation is a guaranteed way to avoid prostate cancer. It is absolutely not a substitute for proven prevention strategies and early detection methods. Screening remains crucial. Regular prostate cancer screening, based on discussions with your doctor about your personal risk factors and preferences, usually involving PSA blood tests and possibly DREs, remains the cornerstone of early detection, which is key to successful treatment if cancer does develop. Don't skip your checkups. Focus on proven lifestyle factors. The factors most strongly linked to overall health and potentially reduced cancer risk are things like maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, and potentially lower in red meat and high-fat dairy. Engaging in regular physical activity, not smoking, a potential minor benefit, not a mandate. If you enjoy masturbation and engage in it regularly, the possibility that it might offer a small additional benefit regarding prostate cancer risk could be seen as a potential bonus. However, there is no medical reason to force yourself to masturbate or achieve a certain frequency if you don't feel the desire or inclination. Personal comfort, desire, and choice are paramount. There's no prescribed dose. Masturbation and other prostate conditions, BPH and prostatitis. What about the effects on non-cancerous prostate conditions? Benign Prostatic Hyperplasia, BPH. There's no strong evidence that masturbation significantly worsens or improves BPH symptoms in the long run. Some men with BPH report a temporary feeling of relief from urinary symptoms shortly after ejaculation, possibly due to relaxation of pelvic muscles. Others might notice no difference, or even temporary worsening if they strain during orgasm. Overall, it's generally considered neutral regarding the progression of BPH itself. The best approach is simply to listen to your body. If it feels fine, it likely is. If it seems to aggravate symptoms, you might naturally choose to do it less often or more gently. Prostatitis. This is more complex, as there are different types. For some forms of chronic prostatitis or chronic pelvic pain syndrome, doctors sometimes recommend regular ejaculation 2 to 3 times a week as part of management. The thinking is that it may help drain the prostatic ducts of inflammatory secretions. However, during an acute bout of prostatitis, especially bacterial, ejaculation might be quite painful and could potentially worsen inflammation. The critical takeaway here is, if you have been diagnosed with prostatitis, you absolutely must follow your doctor's specific advice regarding sexual activity and ejaculation frequency. Don't self-treat based on general information. Addressing common concerns for older men. Let's tackle a few other related questions or concerns older men might have. Will masturbation make my prostate grow? There's no evidence that masturbation causes or accelerates BPH prostate enlargement. BPH is primarily driven by hormonal changes related to aging. Will it wear out my prostate? No. The prostate isn't like a machine part that wears out from normal use. Producing seminal fluid and releasing it through ejaculation is a normal biological function. Does it affect erectile function? Long-term, no. While achieving and maintaining erections might change naturally with age due to various factors, circulation, nerve function, hormones, medications. Masturbation itself doesn't cause erectile dysfunction. In fact, staying sexually active partnered or solo can help maintain blood flow and tissue health in the penis. What if it's difficult to achieve ejaculation now? This can happen due to age-related changes, medications, or health conditions. It doesn't mean you have to ejaculate for prostate health. Remember, the link is speculative. Focus on overall health and discuss any bothersome sexual function changes with your doctor. Pleasure and intimacy don't always require ejaculation. Safety and comfort are key. While masturbation itself doesn't harm the prostate, ensuring the experience is comfortable and safe overall is important, especially as we age. Listen to your body, avoid any activity that causes pain. If you have pain during or after ejaculation, mention it to your doctor. Use lubrication if helpful. While men don't experience vaginal dryness, some older men might find that erections are less firm or skin is drier. A water-based lubricant can enhance comfort and reduce friction during self-stimulation. Hygiene, simple hand washing before and after is always good practice. Manage expectations. Your sexual response might be different than when you were younger. G. Needing more direct stimulation. Erections less firm. Orgasm less intense. Longer time needed between erections. This is normal. Focus on the pleasure and relaxation you experience, rather than comparing to the past. Mental health benefits. Don't forget the potential positive side effects: stress reduction, mood improvement, better sleep, which contribute to overall well-being. Indirectly supporting physical health too. Putting it all together, a holistic view. When thinking about prostate health, it's essential to see the big picture. While the potential link between frequent ejaculation and slightly lower prostate cancer risk is interesting and warrants more research, it's likely a very small piece of the puzzle compared to major proven factors. Your primary focus for prostate health should remain on regular medical checkups, including discussions about appropriate prostate cancer screening with your doctor based on your age, risk factors, and preferences. Healthy lifestyle: eating well, staying active, maintaining a healthy weight, avoiding smoking. Awareness of symptoms, paying attention to any changes in urinary function or other concerning symptoms and reporting them to your doctor promptly. Masturbation fits into this picture as a normal, generally safe activity for most older men. If you enjoy it, there's no medical reason related to prostate health to stop. And there might even be a small potential benefit, though unproven. If you don't have the desire, there's absolutely no reason related to prostate health that you need to engage in it. Your personal choice and comfort should guide you. Think of it like this: eating broccoli is definitely good for your health. Going for regular walks is definitely good for your health. Getting screened for cancer is definitely important. The potential effect of ejaculation frequency is much less certain. Maybe like adding a specific spice that might have a small extra benefit. But isn't the core ingredient of the healthy meal? Focus on the core ingredients first. Your health, your choices. Understanding the current science helps dispel myths and allows you to make informed choices without unnecessary fear or obligation. You have the freedom to decide what role sexual expression, including self-pleasure, plays in your life, based on your own desires, values, and comfort level. Knowing that masturbation doesn't harm your prostate and might have a small potential plus, while not being a replacement for real health strategies, can bring peace of mind. It allows you to focus your health efforts where they are most proven to make a difference. So, what should older men know about prostate health and masturbation? The key takeaway is that masturbation is generally safe for the prostate and does not cause prostate problems like BPH or cancer. While some research suggests a possible link between very frequent ejaculation and a lower risk of prostate cancer diagnosis, This is not definitive proof and should not replace standard screening or healthy lifestyle choices. Focus on proven strategies for prostate health, regular checkups, healthy living, and make personal choices about sexual activity based on your own desire and comfort, free from outdated myth. We hope this straightforward discussion here at Golden Vitality has been helpful and reassuring. Your health journey is personal, and having clear information empowers you to navigate it confidently. If you have any questions about your prostate health, urinary symptoms, sexual function, or screening options, please schedule a conversation with your doctor or a urologist. They are your best partners in maintaining your well-being for many vibrant years to come. Take good care, stay informed, and continue to live fully.